Hello and welcome to the Always Home Care Caregiver Training and our class on congestive heart failure. I'm Mark Rosny, Certified Senior Advisor, and our guest presenter for today is Gretchen Schmidt, Registered Nurse.
Okay, welcome to today's class on congestive heart failure, now simply called heart failure. When a patient is diagnosed with heart failure, it simply means the heart isn't pumping as well as it should be. And more specifically, the heart is not pumping as much blood as the body needs. And over time, the heart weakens. For most patients, heart failure is a chronic and progressive condition, usually leading to lifestyle changes, which we'll go over shortly. A fact, heart failure is the most common reason for hospitalization in adults greater than 65 years old. I want to start by talking about the symptoms of heart failure. Most patients with heart failure will experience these symptoms at varying times and degrees. They may have only some or all of these symptoms, and some being mild and others more severe. It is important to become familiar with them to help your clients cope day to day. First and foremost symptom is shortness of breath, or dyspnea, which is what the medical term that you will hear. Breathlessness doesn't just happen during activity, but the patient also experiences it at rest and commonly comes on suddenly during their sleep. They find it difficult to breathe while laying flat, so most patients will need to sleep with their head propped up on multiple pillows. You'll find that they may wake up tired and feeling very anxious and restless. Next, the patient may experience persistent coughing or wheezing, partly related to the buildup of the excess fluid in the patient's lungs. That buildup of excess fluid is also occurring in the body tissues. It's characterized by swelling in the feet, ankles, and legs primarily, but can also be seen in the abdomen or simply weight gain. You may just notice that their shoes are fitting snugly. Fatigue is another big symptom. Many patients are tired all the time. They find it difficult to do their everyday shopping, climbing stairs, or even walking. Their daily activities may some days be slowed down due to this fatigue. Next, we have lack of appetite or nausea. A client may have a feeling of being full or sick to their stomach. At this point, a bland diet or small meals may be the best choice, and plenty of fluids to keep them hydrated. They may experience confusion and impaired thinking. That can entail memory loss and feelings of disorientation. And as the caregiver, you may be the first to notice this. Clients may say they feel their heart is racing or throbbing. This is usually a sign of increased heart rate or palpitations. It is very important to know that at any time these symptoms are worsening or appear life-threatening to call 911 and get help immediately. A patient diagnosed with heart failure will usually have an extensive care team working with them. They may include a primary care physician, a cardiologist, other doctors, specialists and surgeons, clinical nurse specialists, and nurse practitioners. Most clients will have frequent visits to see their care team, and a thorough history and/or log of their symptoms is really helpful. As a caregiver, you can assist your client and family in keeping track of the progression of their disease. You may be the first to notice something or changes that are occurring. A good communication log is essential. Next, I will discuss health maintenance of a patient with heart failure. Depending on the degree or severity of heart failure, the client will most likely need some form of daily monitoring. For example, blood pressure monitoring, heart rate, respiratory rate. Some may have nurse visits to include oxygen monitoring. Again, it all depends on how advanced they are in their disease. Most will have regular visits to their physician office with regular blood draws and laboratory tests being performed. Next, I will go over medications used by clients with heart failure. Most will be on multiple medications for the different symptoms they are experiencing. As with all medications, they must be taken correctly. For example, the correct dose, correct time. Some meds are taken with food, some are not. It is very important for caregivers to know these things, as well as the medication schedules to help their client maintain compliance. Most medications will be in pill form, but some may be injections or creams or even IVs. There are a lot of medications available for heart failure. I will briefly show you most of them. It is good to become familiar with those that your client is on to help your client maintain that in compliance. First, we have anticoagulants, or commonly called blood thinners. Here's a list of a few of them. The names on the left are the generic names. The names on the right are the trade names. For example, we have enoxaparin or Levinox, which comes in the injection form, or heparin, which is the most common IV form that's usually given while patients are hospitalized. Warfarin or Coumadin is a pill form you'll see many patients on. It is important to watch for bleeding when patients are taking blood thinners. Serious side effects can happen, especially if they fall, as bleeding can happen in the brain if they've hit their head. Another medication is an antiplatelet agent. Aspirin is one of the most common. You'll see many of your patients on aspirin or some form of blood clot prevention. Next, we have angiotensin converting enzyme, or ACE inhibitors. Captopril, enalapril, lisinopril, those are some of the common ones. These lower the patient's blood pressure and allow the blood to flow more easily and makes the heart work easier and more efficiently. Next, we have angiotensin II receptor blockers, or inhibitors, also known as ARBs. These medications also are used to treat and improve the symptoms of cardiovascular conditions, including high blood pressure and heart failure. They work a little different than the last group of meds, so you may see one of these instead. Another common medication heart failure patients are on are beta blockers. A common one is propranolol. These meds decrease the heart rate and the amount of blood coming from the heart, which lowers blood pressure and makes the heart beat more slowly and with less force. Another common medication is a calcium channel blocker. Nifedipine, or Procardia, is a common one. This is another med used to treat the high blood pressure, but it also is used for chest pain caused by that reduced blood supply to the heart muscle and some of the arrhythmias that these heart failure patients experience. Most heart failure patients will be on a diuretic, also known as a water pill. Lasix is a very common form of a water pill. These meds are used to help lower the blood pressure. They help reduce swelling or edema from the excess buildup of fluid in the body. As a caregiver, you should know that the patients will need to use the restroom more frequently as the fluid is eliminated by urination. Next, we have vasodilators. Nitrates, or the nitroglycerin tablet, is a common. These meds relax blood vessels and increase the supply of blood and oxygen to the heart while reducing its workload. They can come in pills to be swallowed, chewable tablets, and as a topical application cream. Next, we have Digitalis Preparations, also known as digoxin. Digoxin helps the heart have good, strong, productive, regular heart contractions. It increases the force of the heart's contractions, which can be beneficial in heart failure and for regular heartbeats. Lastly, we have statins. These are common types of cholesterol-lowering drugs. Lipitor is a common one of those. These are used to lower your bad cholesterol and raise your good cholesterol while lowering your triglyceride levels. Clients will be on these because the bad cholesterol leaves deposits in the arteries and the heart, which can make heart failure symptoms worse. Lastly, I would like to go over important lifestyle changes. Quitting smoking is very important. Hopefully a client with heart failure diagnosis has already quit smoking. Losing or maintaining weight is important for better outcomes. Tracking the patient's daily fluid intake is vital. Dehydration happens fast and can lead to more serious problems. Next, we suggest the client avoids alcohol or limits caffeine. Eating a heart-healthy diet is very important. Most heart failure patients will see a dietitian at some point and go over the foods that are heart healthy. As a caregiver, becoming familiar with these diets is beneficial to keep your client on track and supported. Managing stress provides overall better health. Being physically active helps maintain good blood flow and oxygen to the brain and tissue. Lastly, monitoring your blood pressure is very important. It's important to track and report these results to the care team so medication adjustments can be made to keep the blood pressure normalized. I'm going to continue with lifestyle changes. Getting adequate rest is also very important. All of these symptoms take a toll. Rest regenerates the body and is very important for your client. Avoiding the flu and pneumonia with vaccinations. These are also recommended. When selecting appropriate clothing for your client, remember to avoid those tight socks or stockings like the thigh highs or the knee-high hose because they can slow blood flow to the legs and cause blood clots. Also try to avoid temperature extremes as much as possible too. Have your client dress in layers so you can add or remove garments as needed. Your clients will be healthier and happier if they follow these lifestyle changes. Next, I will go over when to notify healthcare contact immediately. Here are some red flags to be aware of. A patient's rapid weight gain. Record the patient weights and report any changes. Shortness of breath while at rest, not related to exercise or exertion. When your client is in distress, don't wait. Increased swelling of the lower limbs, the legs or the ankles. This may be a sign of a blood clot. It's important to note swelling or pain in the abdomen. A patient who has trouble sleeping, awakening with shortness of breath or needing to use more pillows. This is increasing signs of distress. It's another red flag. If your patient has frequent dry, hacking cough, it's important to report. A loss of appetite when the patient refuses to eat or isn't taking adequate food or fluids. Increased fatigue or feeling tired all the time. When your patient is unable to get out of bed or maintain current level of activity, notify someone as it may be a sign of worsening heart failure. Heart failure is a serious medical condition, but many people live many years and maintain their disease quite well. With the help of caregivers, many can continue with their lifestyle and lead to a new normal. Thank you for caring.
Thank you, Gretchen. For more information about heart failure, visit the Heart Failure Society of America or American Heart Association. And if you have any additional questions after reviewing this recording, please email training@alwayshomecare.org and we will get your questions answered.